One. We're going to go ahead and get started. Welcome to today's Age Well series presentation. We have the 5 M's, which is a practical guide to aging well, which we all, I'm sure, want to do. So thanks for joining us today. My name is Jill Rankin. I'm the Executive Director here at the Wisconsin Institute for Healthy Aging. And we are very excited to bring to you today this topic. We were going to talk about mind, mobility, medications, multi-complexity, and what matters most. A little bit about our organization and the services that we provide is we really aim to improve the health and well-being of all of us as we age here in the state of Wisconsin, and we work also nationwide. We do that by developing curriculums, health education curriculums, and then train our partners on those curriculums. And then we have amazing partners throughout the state of Wisconsin and also nationwide who deliver evidence-based programs that we know work. We know that they improve the quality of lives of all those who take them, myself included. So we're really excited to be able to have those programs and partners. But then also today, we also bring you the Age Well series. And that is a mini version of a health education program, because we know that sometimes, 1 hour health education presentations is a really great way to stay engaged and to learn more about how we can improve the quality of our life and enjoy the life that we have. So that is the purpose of today and the purpose of our organization. So we encourage you to check out our website if you haven't yet, subscribe to our newsletter, and all of the good stuff that we have in there. We're happy to talk with you about. But today, without further ado, I'm going to go ahead and introduce our speaker, Jonathan Weiss, and he is a board certified specialist in geriatric physical therapy. So you all are in for a wonderful treat. John is very knowledgeable and very passionate about aging and healthy aging. He's a certified exercise expert for the aging adult, and he is with Bellin College. He also, fun fact, is a member of the Wisconsin Institute for Healthy Aging's Board of Directors. So we often get to hear from John. He's got wonderful things to say, and so we're excited to have him talk with you all today. So a little bit of housekeeping. We are going to have John speak. He is actually live at the ADRC of Brown County. So he is going to be talking with his live group as well as those of us who are virtual. So we'll be able to listen to John and we'll be very interactive. We'll have a Q&A, some question and answers at the end of the presentation. So feel free to stay on mute during the presentation, but go ahead and type any of your questions into the chat box if you'd like, and we'll get to those at that time. We also, when we open it up for Q&A at the end, if you'd rather just come off of mute and ask the question verbally, we can do that as well if you don't prefer to type in the chat and would rather be verbal. So lots of options for you to engage today. So I will hand it over to John. Thank you for being with us.
That's great. Thank you, Jill. And if we could get that reverb, that would be great. But thank you all for coming. Whenever you get asked to do a speech, you always wonder, is anyone going to show up? And we have a full room here, and we actually had to add some seats. So I'm really excited. Yeah, so I'm really excited. And I hope that just maybe one or two things that you can take away to help you lead a healthier life as we go about this aging, as we all go about this aging journey. So just a little bit about me. Again, my name is John Weiss. I grew up in a little small town in northern Minnesota, which makes me a Minnesota Vikings fan. Okay, right. But I have lived in Green Bay for over 30 years now. So the Packers are my number 2 team. All right. And you all always have to feel sorry for me as a Vikings fan, right? We can never quite cross that line. So little sympathy is always welcome. But I went to physical therapy school at the University of North Dakota, and I got some additional training at some other schools and ended up in Green Bay in 1995. And my specialty at that time was sports medicine. So I was the one that was, if you went to a football game on a Friday night, I was the one running out there. I was the one on Saturday morning treating all the athletes. Did that for several years and then decided I needed a change. And that was when I really discovered my passion of working with older adults. And that's where I have focused my career since that time. And currently, I used to practice at Bellin Health, now Amplify. That's where I worked for many, many years. And now I get to teach our next generation of physical therapists at Bellin College. We have a physical therapy educational program at Bellin College. We started in 2022, and we graduated our first class last year. And where second class is set in a few weeks. And what's nice is those people are all going, my graduates are all going to come out and help all of you then, and me in the future whenever we need it. So, all right, so today our focus is going to be on what we call the 5 M's. And the reason I wanted to bring this topic to you is, fortunately, people are living longer and healthier lives. Okay, so if you look at the age and how long we're living, that is slowly going up and has been slowly. Maybe not as quick as we want, but slowly overall. As we get older, though, our bodies can tend to change, and we may be faced with health conditions or maybe some other non-health conditions that affect our health. And we're going to talk about that a little bit later. It gets more complex. Our healthcare management becomes more complex as we get older. And what the 5 M's are 5 areas of focus of healthcare for the geriatric person or the older adult. So as a specialist in older adult healthcare, these are the 5 M's that we focus on when you come into our office. And my hope for you today is to introduce you to these 5 M's, ask you some questions to see, well, maybe that's an area I might choose to work on myself, and give you a few suggestions, or maybe at the minimum, give you some talking points that you can go and talk to your healthcare team about so that you can make the best decisions possible about your healthcare. Okay? So I have a lot of notes, and I always do this. I write this full script and then I just kind of wing it. But there's a lot of important information that I want to share with you. So I'll be glancing down with you. So we talked about how our health conditions can change and the conditions can change, and what matters most to us can change as well. And that's a really important part of what we're going to talk about today. So let's see, do I have to point this somewhere to advance it? Let's see, I have it. There we go. Oh, so I was going to quiz you all. Jill mentioned the 5 M's, and I was going to quiz you all, but I already hit the button too fast. So we won't do the quiz. But these are those 5 M's. So these are all targets or focus areas that we as healthcare providers look at, and that you want to go ahead and think about in your own life to see how we can best manage your healthcare journey. So those 5 M's, we've got mind, mobility, medications, multi-complexity, and what matters most. And we're going to dive into each of those M's throughout this time today. Okay? All right. So the first, I hope all of you have a healthcare team that you currently engage with. You probably work with a primary care physician, a primary care nurse practitioner, maybe a physician assistant. That's probably the lead of your healthcare team. But there's so many other members of your healthcare team that can help you with specific issues that you have. And I'm going to talk about some of those members today, maybe introduce you to some of those members today, because we're here to help you as you navigate the complexity that can occur as an older adult. And each of your healthcare teams is going to be unique. Some of you may have a neurological issue going on and you may work with a neurologist. Some of you may have diabetes and you work with an endocrinologist. So everyone's healthcare team is different. But what I'm hoping today is to empower you to take control of your health and for you to go in to that healthcare journey informed and be able to ask questions and maybe ask for certain services or referrals, and really you lead your team. So we talked about that team. You're the leader, you're the captain. And I hope to give you, captains have to lead, and the more information we have, the better. So that's really what the goal of this program is today. Okay? All right. So the first one we're going to do is we're going to talk about mind. Okay, so this is the first M. So when we're talking about mind, we're talking about how we think, how we feel, and how we remember. Okay? And so with each of the M's, I'm going to ask you some questions. And I would ask you, I'm going to go through them a little bit slowly because I want you to just take a moment and reflect if you answer yes or no to these. And it's not right or wrong. It's a yes or no. And if there is a yes, then we'll provide you with maybe some suggestions to help. And if you answer no, then I can also provide you with some things to help prevent these issues from coming on in the future. Okay? So the first question is, do you feel down or depressed? Okay? Another question, do you feel drowsy? Do you have a good amount of energy during the day? Do you feel confused or foggy? Do you feel lonely? And then lastly, have you noticed a decline in memory? Sure.
Sometimes you may be depressed
Yep.
in a moment, but then you're out of it.
Yep.
So we can address.
Yes, we are going to address that in a little bit. So I'll hold that. Okay. Yep. That's a great question. And we feel that it's normal to feel this for a short term. I'll answer your question a little bit right now. It's normal to feel a little bit blue or a little bit drowsy. But if that persists, and we always say if it lasts longer than 2 or 3 days, that's when we might want to address it. Okay? So, and we'll talk about that a lot more as we go on. So I hope that you can answer all of these no. But if you can't, that's okay. And we're going to talk about some strategies to help with that. First of all, you want to talk to your medical care provider. Okay, so that's your first line of defense. And if any of you work with a neurologist, obviously they are very well trained in dealing with issues of the mind. And some of you may also work with a counselor or a mental health specialist, a psychological therapist, a psychiatrist. Those are wonderful people to talk to and engage in as well if you answered any of those questions. The primary care provider is always a great place to start because they can refer you into those other more specialized areas if you should need it. The one thing I want to iterate in terms of mind, though, is memory decline is not inevitable. Okay, memory decline is not inevitable. As we age, you are not necessarily going to lose memory. So I know Michelle knows I'm a big, huge theater person. So this is why I like performing or talking in front of people. And in January, I was out in New York City and I saw a Broadway play that lasted an hour and 20 minutes. There was the lead actress. She had the most lines of the play. Her name was June Squibb, and she's 96 years old. She's been an actress since the 50s. And it was amazing what she did. But I just say that to prove a point that our forgetfulness, that's not necessarily normal aging. And it's okay if we forget something once in a while. I do it all the time as well. And there, again, are strategies that we can look at that. Another nice question to answer is, what motivates you? What makes you happy? What makes you smile? We were talking about gardening before and how we started planting some seeds today. That's great. That's important to think about when we think about our mind as well. So for each of these M's, I'm going to give you an action plan. Okay, so these are some of those strategies that you can engage in right now to maybe address if you said yes to any of those questions, or to help keep your mind sharp. So one of those is to maintain mental activity. All right. So some of us are more comfortable on our phones or our pads or our computers, but there are some wonderful apps that are available, games that you can play right on the computer that can help keep our mind sharp. Also, I always recommend those catalogs you can usually buy at the grocery store or bookstore, like Sudoku or crossword puzzles or all of those, or simply just puzzle pieces, the tried and true puzzles. Those are all great activities to help keep your mind sharp and keep that mental activity. Learn new skills. Take a class, take a risk. I know the ADRC offers classes, and all the time I live in the village of Ashwaubenon, which is a suburb of Green Bay, and at least twice a year I get a catalog that's full of different classes I can take in my community. And one of the things I would challenge you, learn a new language and then go travel to that place. I mean, isn't that a fun thing? I love to travel as well. And I did that a few years ago. I learned Spanish, or tried to learn Spanish. Don't ask me about it anymore, though, because I've probably forgotten everything. But go ahead and do that. And it's even better if that's a group activity. All right. So it's wonderful to have people around us to share our experiences with. My next suggestion for you is get out of your home. Now, some of us are a little quieter and we love our home, and that's great. But once in a while, we have to get out and live in the world. And you are all a testament to that here in the room, because you've gotten out. So that's wonderful. This is where we participate in clubs, do our volunteer work, and participate in those regular social outings. And then we do have to recognize and treat depression, okay? Like I said before, it's okay to feel blue, all right? But if it lasts longer than 2 to 3 days, or if there are things that, remember I asked what motivated you, things that make you happy, and now they don't, or you don't look forward to that anymore, that's when you should seek help. And again, your primary care provider is a great first line of defense to help with that as well. And one of the reasons people can become a bit depressed is as we get older, we tend to lose some of our loved ones around us. I'm sure we all have friends, family that were near and dear to us, and they move on, right? And we stay here for a little while. And so it's important to share that and talk about that and recognize that that can be a source of depression, but there are ways to mitigate that. I've worked with so many people that have told me that they feel lonely. And I've talked about, well, what about reaching out to your kids or your grandkids? And a lot of them say, oh, John, I don't want to bother them. But I would challenge you to reach out, because they want to be there and they may not know how to best help you. And sometimes it's just a matter of spending time together, right? Spending time with loved ones. But then we also talked about getting out of your house and engaging in social interactions like we are today. So I always say, reach out, make those plans, be brave, and put yourself out there a little bit, okay? All right. So another thing we can do to keep our mind sharp is to maintain a healthy lifestyle. So this means participating in aerobic exercise. So aerobic exercise is that type of exercise that's geared toward your heart and lung. It helps the blood circulate. It helps get that oxygen going, okay? And we're going to talk about that later today. We're going to go more into that. We also recommend strength training and participating in activities that we call mind-body practices, like Tai Chi and yoga. Have any of you ever participated in Tai Chi? A few of you? Or yoga? So you have to focus and concentrate when you're doing that, but you're also moving your body. So it's a wonderful integration of the mind and body. Now, when I talk about strategies to keep your mind sharp, you may not think of just these normal, healthy lifestyle strategies to help keep your mind sharp, but they definitely can, okay? A couple other things related to healthcare that you may not think about in terms of affecting your mind is keeping your blood pressure under control. It's something I struggle with. Also, trying to keep your cardiovascular risk as well, keeping all of those factors under control. Also, screening for your vision and your hearing on a regular basis. There are so many wonderful advances, particularly in audiology, in helping us hear better and to help us see better as well. And that is all going to help keep our mind sharp. So that, again, we talked about your healthcare team. If you haven't engaged with an eye doctor or an audiologist, maybe that's something you want to talk to your primary care provider about or explore a little bit on your own. All right. Also, the normal things we talk about: proper nutrition, minimizing alcohol. Notice I didn't say stop, because a little bit once in a while is okay. Yeah, but I will say to avoid smoking. So those you've heard before, but again, I want to repeat it because they're very important in keeping our mind sharp. All right. So I'm going to move on to the second M now. We're going to go to medications. Okay, so we go from mind to medications. So again, I'm going to ask you a few questions for reflection to see where you're at. So the first thing, it's not on the list here, but I truly hope, I'm sure some of you are on prescription medications. I am. And I hope that you know exactly why you're taking that. Okay. I've walked into people's homes. I did home health physical therapy. So I was honored to be able to go and treat people in their own homes. And we would talk about medication. And many of them opened their cabinet and it was like a whole drugstore was in there. There was lots of different bottles. They weren't sure what was in there. And I would look, and I'm sure some of these were almost as old as I was. Right? And so we have to manage those medications. And some people like to save all that. They don't know when they're going to need it in the future, so they keep a lot of that medication. But we want to get rid of that medication, that old medication. Okay. And a lot of times there are, I don't know if the ADRCs do it specifically, but a lot of healthcare systems have medication drop-offs that you can go, and we do. So the Brown County ADRC has drop-off. Fantastic place to go ahead and drop those medications off. You don't want to save those medications. So real quick, so understand why you're taking each of the medications. So these are the questions we'll ask. Do you have difficulty keeping track of your medications? Do you have difficulty taking the medications at the right time? So taking medications at the right time or the wrong time can greatly affect how alert we are or how drowsy we are during the day. Okay? It can also affect our mobility or how we move and get up. How easy is it to stand up and walk around? Our medications can affect that. And timing is very important if they are prescribed for certain conditions, such as Parkinson's disease, where there's certain medications where there's a window that they can function better. Or if anyone has ever taken medications for pain, timing is real important for that as well, because those medications kind of go up and down. So timing is really important to consider. And if that's a challenge for you, again, there are strategies to help with that. Do you ever miss a dose of medication? And if so, how often? I started using a medication planner myself a couple months ago. So I've got my little box and I've got a couple things in there because I didn't think I was missing. And after I was missing probably one every 2 or 3 weeks. Now that's not a lot, but now I don't miss them anymore at all. So it's something to think about. And those are just those simple boxes that we have. We usually fill them up at the beginning of the week. We've got them all for the rest of the week. All right. So if you are having any issues with your medications, obviously, again, we need to talk to your primary care provider or a pharmacist. Some of the other strategies are okay to implement on your own, but any medication strategies, we want to make sure we're in communication with the providers, okay? So just kind of an important talk. So when you go and talk to them, I would challenge you to ask about interactions for your medications, okay? Unfortunately, I'm going to let you in on it's a poorly kept secret, but sometimes in healthcare, we work in silos. So one doctor may be treating your heart and dealing with heart medication. One doctor may be treating your skin and working on different medications. And unfortunately, sometimes we don't do a good job of talking to each other or looking what other providers have prescribed. That's where you have to come in to ask about interactions. Here's my list of medications. Will this interact with any of my other medications? Okay. We have to take control of our own healthcare. We have wonderful providers out there, but for me, I don't like to assume that they've reviewed that all. So it has to kind of come on to ourselves, right? Also, know about potential side effects of your medications. And this is particularly important if you are getting a new medication or you're changing an existing medication. And why this is important is because then if you begin to recognize that in yourself, you know to go back and say, hey, Dr. So-and-so, I'm taking this medication and I'm having this side effect. And in pharmacology, it is not an exact science. So there may be some other options. I was just working with a client this morning who asked to get his blood pressure taken. We took it. It was normal. And so I said, so what's been going on? He's like, I've been getting dizzy when I've been standing up. I feel a little woozy. And that is a hallmark sign of low blood pressure. And he is taking high blood pressure medication. So I challenged him to talk to his provider about seeing if we can decrease that dosage a little bit. Okay. So that's just an example. It may not, I don't want to make generalities about that. This was an example for this one person where his medication may be actually working too good or too well. Is any English teachers in the room? All right, so thank you. So too well. So he's going to talk to his prescriber about that. But that's why it's important to know those side effects. And then lastly, try to work with your provider to reduce the number of medications. Okay? Less medications equals less chance of side effects and less chances of interactions. Remember, this isn't something you want to do on your own, but overall, we should not take a medication thinking, do we have to be on it forever? And there are some medications we do, but there are some that as we get older and our bodies change, we may not need in the future. And blood pressure is actually one of them. I've seen many people be able to get off blood pressure medication as they get older. But again, I don't want to make that's a gross generality. I don't want to say get off your blood pressure medication, but always talk with your provider about that. At least have the discussion, and then you can make the decisions together, right? Okay. All right, so that is it for medications. Now we're going to move on to multi-complexity, which is probably the most broad M of the day. All right, so multi-complexity, as we get older, we talked about this before. As we get older, we may experience more conditions, maybe more diseases, because we get older and our tissues just don't respond to stress like they used to. So this is the person that may have high blood pressure, but then they may also have some other diseases, and all of that contributes to multi-complexity. All right. So they're really, and this can lead to hospitalizations. And when we're in the hospital, you know, there's a million things going on, and your goal is to get home, right? But if you are ever in the hospital, make sure you understand those discharge instructions. And if you don't, call a timeout, okay? And say, I don't understand this or what I should do when I get home. And the nurses and the physicians will help you make sure you understand. Because one of the things we don't want to happen in healthcare is for you to go in the hospital, go home, and then have to come back in. Okay, so that just kind of contributes to that multi-complexity to make sure that you know. So we want to really work with our primary care providers, our specialists, in terms of managing all those health conditions. But the thing I wanted to talk a little bit more about is there are many non-health care conditions that affect our health. Okay, so these are factors that you all experience that affect our health. And this falls under the banner of multi-complexity. In the literature in healthcare, we call these social drivers of health. Okay? This means that we may live in certain environments or in certain situations that can potentially be unhealthy for us. And so I want to talk about that a little bit. The first has to do with where we live. All right? So as we get older, we need to answer some big questions about where we live, right? So can we still manage all of our house cleaning safely? Can we still do the laundry safely? Lawn care, snow removal, all of those types of things, right? So some of you may be able to do that, and that's fantastic. But sometimes if those things can't, we have to talk about living situations, okay? So I can't solve your living situation today, but that is an issue we have to think about. And ideally, we prepare for before and make some decisions before the issue happens to us, okay? So my parents still live on a farm. They live about 10 miles from the nearest town. They live about 20 miles from the nearest hospital. And we're already having those conversations. Now, thankfully, they're independent. They're managing things just fine. But we're already talking about those situations as a family and what's going to happen into the future. So next, are we having any financial barriers? All right. Many of you may have lived on a fixed income, and do you have the resources to survive and to thrive? And we're going to talk about people you can talk to and engage with if you are struggling with any of those issues as well. We've brought this up already, but are you lonely? So that's really a term that fits into this area we call social isolation. It was a big deal about 5 years ago, right? During the COVID pandemic, we were all isolating. And it was a very lonely time. And we saw a lot of health issues that came maybe not as a result of COVID, but of people not engaging with each other. A lot of mental health issues. Okay, so but social isolation is one of those other factors that can contribute to that multi-complexity. Transportation, which I know can always be a very touchy issue with people. Just the thought of maybe hanging up the keys can probably cause a lot of anxiety in us, right? And so I've had many conversations with people about their transportation status, and there are specific testing you can go through and objective measures that we can see to help determine maybe your risk for driving. But those are some tough decisions that you have to think about, right? And we have to think about not only our own safety when we're driving, yeah, but the other people that are on the road with us as well. So those are some things to think about. And again, these are nice issues to think about before that time comes. What's your plan? Okay. Lastly, I just want to talk about communication. Some of you may have English as a second language, and so it may be a little bit more difficult for you to communicate with your healthcare provider. So you want to make sure that you ask your healthcare provider, can a translator be available? Also, if we are having hearing issues or things like that, that's why that hearing is so important, so that we can communicate effectively. And sometimes we may have trouble getting the words out as well. So we may bring a family member or a trusted loved one with us to help with our communication as well. Okay? So this all kind of I place this under the banner of that multi-complexity. These are all things that are not health themselves, but affect our health. And if we can optimize all of these issues and plan for them, we can live a long, successful, healthy life. All right. So the most important thing that I feel you can do, so we're on the action plan part, when we're talking about multi-complexity, is have that interprofessional collaborative care team around you. So this is that healthcare team that I've talked about that may be made up of other healthcare individuals. All right. So we've talked a lot about the physician, the advanced practice nurse, the physician assistant, the nurse. Now we're going to get into some other type of healthcare providers. All healthcare systems have social workers that can help you navigate, especially some of those non-health issues, those ones that we just talked about here. Social workers are excellent resources to engage with, to help you strategize and come up with solutions that work for you. Also, many insurance companies, if you have their insurance, they have maybe case managers that can help you with as well. And then we want to capitalize on our community resources. I'm preaching to the choir here because you're all here at an Aging and Disability Resource Center. This is an excellent resource. There are people that can also help you with all of these non-health factors that affect our health. You can sit down and they can get to know you on an individual basis and again, help you make a decision about what solution is right for you. Never hesitate to reach out for help with these issues. There's lots of resources available. We're very lucky in the state of Wisconsin to have this solid network of aging and disability resource centers. And I know we're very fortunate here in Green Bay, and I know we're fortunate all across the state of Wisconsin to have such fantastic organizations in our communities. Another resource you may not know about is 211.org. So it is a website, it is a public website, and it has a lot of national and state. I'm not sure if it's a lot of local. I'd have to explore it a little more, but it's 211.org that can also provide many resources for you, particularly in working with some of those non-healthcare factors. And then our places of worship are also excellent resources for you to find help, to talk to people, to engage, and maybe someone has also experienced the same issues you're having, and you can see they can help point you in the direction of one of those options. All right, so before leaving multi-complexity, I did want to share these are programs that the Wisconsin Institute for Healthy Aging, these are programs that we administer through our program partners. So these programs are, many of them are available here at the Aging and Disability Resource Centers across the state, but there are other partners that also provide these programs. And these are specific to some of those diseases, those processes that happen, that occur to us as we age. The ones with stars here also have Spanish versions available. And many of them, each of these classes are a little bit different flavor. Some of them are short, some of them are a little bit longer. Some of them we're trying to move to more online classes to, again, if someone doesn't want to leave their home, especially in the Wisconsin winters, that's a nice option. But these are classes that are available to you right now. And I'll give you a resource at the end of a place where you can look up no matter where you live in the state and see if any of these programs are being offered near you. All right. All right, so we're going from multi-complexity to my favorite topic, which is mobility. So mobility has to do with movement. And whenever someone asks what a physical therapist does, I say we are movement specialists. Just like you have a neurologist who is a brain and nervous system specialist, or a cardiologist that's a heart specialist, physical therapists are movement specialists. So this is really my expertise here. So we're gonna dive into that. So when we talk about movement, we're not just talking about moving around in your home, but what about your neighborhood and your community, okay? So we're gonna talk about all that. So here again are some reflection questions for you to see if maybe mobility is an issue that you'd like to work on further or more in the future. So how much do you move in a given day? Do we spend time sitting in our recliner and just get up to go to the bathroom and have a snack? Now, all of you here in the room or in the community, that's fantastic. But sometimes we know people that they really like their recliner, right? And they sit there and they get up to go to the bathroom or grab a snack, and then they're back. I used to say watching Bob Barker on The Price is Right. I know that's not Bob Barker anymore, but that's what they do. So those are some questions to ask. And then when we do move, how easy is it? Okay. Are we experiencing pain? Are we experiencing stiffness? Are we experiencing fear? We're going to talk about that a little bit more. All right. How do you get around your home? Now, I've worked again with many people in their home and they're furniture surfers. This is how they walk. Or they walk along a wall. Okay. That's not safe. And there are strategies we can work with you to try to prevent that from happening. So these are questions. And again, all of you are here in the room, but some of you at home, you have to ask yourself these questions in terms of how do you get around your home and how often you get out of the house and how challenging is it to get out of the house. Some people, just to go up and down those 2 to 3 steps is quite a task. And so that your mobility is affected. Okay. All right. Does pain prevent you from moving? Now, many people are fearful of pain. They equate pain with tissue damage. Something's bad. Okay. And that sometimes is the case, but sometimes it is not. And pain, especially if we've had pain for a long time, it gives us signals that may not really truly relate to tissue damage. So what I mean by that is there are times where you can respect your pain, but don't be afraid of it, that you're experiencing some aspect of pain. And physical therapists, physicians, we can help you tease that out. Is this pain that we can acknowledge and put up with, or is it pain that we should really be dealing with? Okay. So again, pain is an aspect of it. And then we talked about fear. Does fear of falling prevent you from moving? Now, why is fear so important? If we're afraid to get out, if we're afraid of falling, what do? We sit. And when we sit, our muscles get weaker, our joints get stiffer, and then it gets harder to move, and we become a self-fulfilling prophecy, and we are putting ourselves even farther at risk more at risk for falling. Does that make sense? So it's kind of this vicious cycle. We're scared, we stop moving, we get weaker, we get more stiff, and then we end up falling again because our bodies are made to move. We're made to move, okay? So movement is a very positive aspect of any type of healthcare. We always say if we could put exercise and movement in a pill, it would be the greatest seller of all time. There are very, very few side effects that occur with movement. And we talked about medication, right? Which is, yeah, and medications now are kind of the front line in healthcare right now, correct? So if we can try some of these non-pharmaceutical strategies, such as movement, we can go a long way without the risk. A few other questions. Do you require an assistive device? Or has anyone told you you should use an assistive device? Now, there's a lot of people have a little stigma about assistive devices. They don't want to look old. They want to make, and I've had people tell me that, and they don't like to use it. But there's some times where it is a wise decision to go ahead and use that. Now, have you had any falls? Now, whenever you come to see me because you've had a fall, I look at the reason, and I've heard it all across. If someone falls from just like getting up and off the toilet, that is very concerning to me. So we have to look at the context of your falls. But if you have had a fall, unfortunately, that does put you at a risk for more future falls. And so we really dive into why you fell. And again, there are many complex factors that can affect your balance. And that's what I am specially trained to do. And that's why I feel if you're concerned with this, you could work with a physical therapist to help tease that out. All right. Now, do you have any difficulty opening a pill bottle? So this is a little different type of movement. We call that fine motor coordination. Okay. And sometimes, we go ahead and I'm just going to use your cup here, but we can't get that pill bottle and we say, here, husband, wife, can you open this for us? Okay. So that's okay. But I would challenge you to work on your strength and your coordination and your mobility so that you can eventually do that yourself. Okay? So keep yourself a challenge. It's real easy for us to just pass that pill bottle to a loved one, but let's challenge ourselves a little bit in doing that. And then, do you have difficulty taking your medications or swallowing? That's a type of movement as well. Obviously, we're moving the medication from our mouth to our tummy. And there are therapists that specialize in the swallow disorders and all that as well. So just to keep that in mind. And then how do you get those medications? How do you shop? Are you able to do that all yourself? Or do you need to engage with loved ones, friends, family in order to do so? All right. So one of the ways to think about this is how big is your life space? And what life space is where you spend the majority of your time. And what I mean by that, I have worked with people whose life space is even smaller than their home. It's their one room. And that's about their life space. They don't get out of that room much. Sometimes it's by choice, sometimes it's not. How about, now we'll expand, how about people that don't leave their home very much? Or then now we can get a little bit bigger. How comfortable are you in getting out in your neighborhood? How comfortable are you getting out in your city, your state, your country, or your world? And what I would say is, if your life space is too small for you, that's when you want to engage with therapists to help you improve that. Another construct to kind of consider is activities of daily living. These are things that you and I do every day that directly relate to our independence. Now, basic activities of daily living, or we call them ADLs, these are necessary for self-care. So bathing, dressing, eating, transferring, which really means like moving from one position to the other, in and out of bed, a chair to another. Continence, which is going to the bathroom, and then toileting, getting on and off the toilet and cleaning. These are all basic activities of daily living. And if you are having a challenge with one of these, again, try to engage with your healthcare team to help and create some goals around this in order to improve your independence. Now, these are instrumental ADLs. These are things that have to happen, but not at the self-care level. So obviously, cooking, housekeeping, shopping, managing finances, managing your medications, using a phone or technology. Hopefully, you don't have any issues. But again, if you do, there are resources available to help you. All right? Now, I'm not expecting all of you to be experts on your phone. There's a lot of stuff I don't know how to do on my phone. But we're talking about basic functions. Are you able to call someone? Are you able to answer calls? All that kind of stuff. So, all right. All right. So now the good news is, like I said, we've talked about rehabilitation therapists. We're here to help. So we've got physical therapists, occupational therapists, speech and language. So I am a physical therapist. And again, we work with movement. All right. We work on walking, standing, getting up from the chair, balance, all of that. An occupational therapist works directly with those activities of daily living. And one funny story that I like to tell is a physical therapist will work on walking. An occupational therapist will make sure that you have clothes on when you walk. Okay? So they help with the dressing aspect to make sure that you've got clothes on. And speech and language therapists help us with swallowing and eating, but they can also help us with our communication needs as well. So we're here to help you when you have needs. And unfortunately, sometimes we see people, they've waited a long time. And then achieving your goals or making improvements can be a little bit harder, okay? Be proactive. If you start answering yes to some of those questions I gave you before, engage with us. And it doesn't have to be a huge, big commitment. Sometimes it's only a few visits. And then we do things at home as well. Now, I'm not going to lie, it's not easy. Pills are easy, in my opinion. You may disagree. Pills are easy. Therapy isn't. You have to work. And we create a program I see a lot of you nodding heads. Probably many of you have engaged with therapists. But again, there's little to no side effects. And our goal is to make you independent and be able to live as long and healthy. I want you to be able to achieve all your goals that you set out for yourself in your life. All right. So bottom line, 10 minutes. All right, great. Bottom line, move more and move often. Okay? And don't restrict your activity out of fear. We already talked about that a little bit. All right, so I want to share with you some physical activity guidelines. These are nationally published from the Center for Disease Control. Again, if any of you have some of those multi-complexities, those comorbidities, health conditions, and you're concerned, should I do physical activity or not? Talk to your provider about that. But in general, we recommend 150 to 30 minutes a week of moderate activity, 75 to 150 minutes of vigorous activity, strengthening your muscles 2 times per week, and balance training. Okay, now the question I always get is, what's a moderate activity versus a vigorous? So notice I really didn't say the word exercise here, okay? Because you don't have to go to a gym. You don't have to just sit and sweat like you see at a fitness center. There are other activities that you can do. Moderate activity can also include sweeping the floor, walking, dancing, vacuuming, washing windows. And a nice gauge, how do we know we're in a moderate activity, is you can talk with someone, but you can't sing. So that means that your breathing is a little bit faster, and you can maybe go for a walk and you could talk to someone, but you wouldn't be able to sing a song to them. You wouldn't have enough breath for that, okay? Versus vigorous activity, now you can't talk to someone else. You're breathing loud, you're breathing faster. And there's more and more research coming out saying how vigorous activity can be safe and effective for the older adult. But again, you work with a therapist who specializes in all that to try to engage in that. And then strengthening at least 2 times, and balance training. There are some great, wonderful programs. Tai Chi is a fantastic exercise. And again, I would just keep challenging yourself. So a lot of people, I've talked to a lot of people, they get that one darn recliner in their house that helps lift them up and down, right? And while that is important for a few people to be able to live a little bit better life, I would say try to push that off as far as you can. Work on your strength, work on your balance so that you're comfortable getting up and down from the chair without having to do those lift chairs, okay? All right, so again, here are a few other programs that are available through the Wisconsin Institute for Healthy Aging that can help you achieve your mobility goals. And again, Stepping On is also available in Spanish. All right, we're to the last M. Actually, 2 M's here. What matters most? This is simply what is most important to you. And you can examine this a bit throughout your day. What part of your day is most important to you? And I know this slide is kind of complex. I got this from an article, but it shows 4 columns up here, which represent the other 4 M's. So when you're working with your healthcare provider, you may come up with some issues maybe about mind, mobility, medication, and multi-complexity. We create a problem list or a list of issues we want to work with. And then we have to run it through this filter. What matters most to you? And that will allow us to prioritize and make sure that we are addressing your needs, not what I think is important as a physical therapist, but what you think is important. So I've had this conversation many times where I have a list of things I'd like to work with or work on with a person. And they're like, that's not important to me. I really want to work on this. And I need to go ahead and, I think I just tapped my mic. So I hope everyone at home I didn't blow out their eardrums. I have to work with them to prioritize what we're going to work on. So talk with your family, talk with social workers, case managers, even some lawyers can help us. Make sure that your needs are documented so that if the time comes where you can't make a decision for yourself or you're unable to communicate real well, you've got that all on file. I'm on the ethics committee at Amplify Health, and almost all of our ethical issues that we deal with have to do with people not communicating what matters most to them in legal documents, and then we have to do our best guess, right? So that comes in. So when we talk about legal documents, I'm going to go through this real quick. We talk about advanced care planning, filling out an advance directive, and I hope all of you have these documents on file. If not, please talk with your healthcare provider. They can get you the resources that you need. ADRC, I'm sure, has these resources available as well. So advance directive, living wills, which essentially, I'm going to just read the definition here. So a living will describes preferences for life-sustaining treatments in situations such as terminal illness or permanent unconsciousness. Naming a durable power of attorney for healthcare, that names that one person that you trust to make decisions for your healthcare if you cannot make it yourself. And we should have this all regardless of age, all right? There are some other physician-ordered life-sustaining treatments. Different states have different terms for this, but this may be, these are very closely related to living wills. And then also we have do not resuscitate order, which tells healthcare providers not to provide CPR. Do not intubate orders, which tells healthcare providers not to provide mechanical ventilation if it was needed, all right? So these are healthcare documents that you want to have. Now, just like you can name someone a power of attorney for healthcare, you can also name a durable power of attorney for finances. It can be the same person. And you can name that person and they're on the list, but they're not active until they are formally activated. So you can have them on your documents and they really don't have any, I'll call it power for lack of a better word, until those are activated. And there's legal definitions of how that gets activated. And then any long-term care planning documents, if you have any desires about assisted living, nursing home, or aging in place, which is whatever place you want to age in, those should be documented as well. You're probably very familiar with wills, which is going to dictate where your estate is divided up to and to who. Funeral or burial preferences, and then personal values of goals of care. You can have conversations or write down what you would like to happen in certain situations. All right, we're just going to wrap up. So really right here, what I want to emphasize, you are the captain of your own team. Okay, so these are all the healthcare providers, most of what we talked about today. You can pick members of your healthcare team to help you with mind, mobility, medications, and multi-complexity, okay? But you have to determine what matters most to you. So if you go on WisconsinHealthyAging.org, I've got the website on my t-shirt right here. Right on the home site, there's gonna be this find a workshop. And this is where you can put in your address and you can find many of those programs and see if any of those programs are offered near you, all right? So I just wanted to kind of, again, just summarize, these are your 5 M's. And really that's my presentation for today. So hopefully you got some positive information out of it. And I'm willing to answer any questions at this time. So, all right.
Wonderful. Thank you so much, Dr. Weiss. Before we jump into questions, I'm just going to go through a quick few things here. So I am sharing my screen and you guys should be able to see that in your room as well. So there will be a survey for those of you who are attending online. And if you fill that out, you will get entered to win one of the t-shirts that Dr. Weiss is wearing right now. So please take a moment to give your feedback on the presentation today. If you found this event helpful or any other of our Age Well series, we would encourage you to make a small donation to help us support this series of events. And then upcoming in our Age Well series, we have a speaker on algorithms and social media who is speaking on April 16th from 11 to 12. And then another speaker on loneliness and isolation and how that impacts the risk of dementia in May. So stay tuned for some of those upcoming events as well. And I'll hand it back over to Dr. Weiss. And I know we are at time, but if you're wanting to stay on and do a couple questions and answers, I think we can make that happen. Thank you, everyone.
All right. Does anyone have any questions online or here in the room? Sure.
So it was just before before you were closing with the Matters Most, and there was a thing that showed Wisconsin Institute for Aging, and it was a screen that said other. I didn't catch what that was.
Let's go back and, oh, I wonder if I.
And John, if you could repeat the question in the room,
Sure.
that would be
So
awesome. Thank you.
the person in the audience had a question on one thing on one slide. So we're just gonna go back a little bit and just make sure we're talking about the slide here. So back, I think a few more, correct? Right before Matters Most. So that was the mobility part. So 2 more, I think. So
That's it. Yeah, I just wondered.
okay, so these are the programs that WEHA offers through our program partners like ADRCs that are directly related to mobility. Have any of you done these? Any of these? Right? Stepping on? Yep. And then I know you offer the extended stepping on or stepping more, I think. Yeah, and then you offer a secondary one too, don't you? Right. It's an individual one here in Brown County. Yeah, exactly. So it's a fall. The question was, what is stepping on? Thank you. Stepping on is an evidence-based program to help reduce your risk for falls. I believe it's a 6 topic. It's usually 6 classes. They talk about vision, medications. Usually a physical therapist is there to show you exercises. There's a couple other topics as well. So those are provided here, and that is, I think, WEHA's most popular program. So those are available all across the state and actually all across the country now. Many organizations use Stepping On. So it was developed in Australia, and then there was research done at the University of Wisconsin to support it. I think Aurora Baker does. Yeah.
They're offered offsite at different clinics, but we kind of help administrate that.
Yeah. Any other questions?
There is a comment.
I think one of those geriatric physical therapists.
So the question was how to find a geriatric physical therapist. There's a website called choosept.org. And on there you can do a visit for physical therapists. Or you can do a search for physical therapists. But the easiest thing is you probably have a relationship with a health system or a physical therapist clinic. Just ask when you call to make your appointment. I'd like to see someone that specializes in geriatrics. Now, there are excellent physical therapists that don't have the specialization certificate that I do that are going to do a fantastic job with you. But just ask when you call to make that appointment. But there is a website, choosept.org, that you can look that information up as well.
This microphone here.
All right.
Do you have a comment? And it says, thank you, John. My mom has moved into an assisted living facility because of dementia. Meg and I turned in today to get tips to keep our brains healthy. Today reassured me that we made the right decision to put mom in her facility. She is safe there, and she has so many options for healthy eating, socialization, and someone there to help her with her meds. So take care.
All right, that's wonderful. It's wonderful to hear. And you know, I appreciate how difficult a decision that is. That has to do with that living condition. Are we living in the right spot? And I know that's such a hard decision to make. So I applaud you for making that decision. And I agree. And a lot of people have an idea. If you haven't visited assisted living facilities, you know, a lot of people have that kind of old-fashioned nursing home idea. And in most places, that is far from the case. These places are nice and they're playing bingo and there's lots of activities. But if you want to just have your alone time as well, there's privacy too. So some of these facilities are wonderful. So again, I appreciate that can be a really challenging decision to do. And I would agree they're in the right place where they can flourish And it's very hard on caregivers as well. And dementia adds a whole new, very complex layer onto everything. And sometimes we need our help. We can't, if we have a loved one that has dementia, it's nice to have, it's good for you to have a little break once in a while and then and engage that team that we talked about. So
I have another question. How do you get a geriatric? Yeah, I lost my mind.
no, that's okay. Let's,
Physical therapist.
yeah, so
Can I just call someone up and say, hi, you know, I need help strengthening my legs, or do I have to go through my?
Yep, great question. So the question is, how do you engage with a physical therapist? And this is the same for occupational therapists or speech therapists. Medicare, if you have Medicare, does ask that you go through that primary care provider. So ask them for that. Now, oftentimes, if you do your Medicare wellness visit, your annual visit, they should be doing some sort of mobility testing, maybe some mental acuity testing, all of that. That's the perfect time to ask. I've been struggling with maybe some of the factors that I addressed today. Would you have any, or I'd like to have a referral to see a physical therapist. And most providers are like, absolutely, they'll get you set up. And then they'll refer you to the physical therapist. If you'd like someone that works a lot in a certain area of physical therapy, like older adults, then just ask that scheduler on the phone and they should be able to provide that to you. So if you have Medicare, the best part is to go through your provider. If you don't have Medicare, you may be able to see that physical therapist directly. We do have limited direct access in the state of Wisconsin where you can come and see me, but with Medicare, go through your physician or provider. And that's only in the state of Wisconsin. If there's anyone on from other states, those rules can be a little different depending on which state you work in. No. In fact, I love working with people that want to prevent the falls from coming because we can have a lot of fun and we can really try to prevent that stuff from happening. That's the best type of healthcare, right? And we don't do it very well. We wait till those injuries happen. But if you can go and try to prevent some of those things, that can be really wonderful. And there are other, strengths, and there's lots of other programs out there. Maybe you don't need a physical therapist, but maybe just getting engaged in strength and wellness programs or programs at fitness centers, or here at the ADRC, there's all those programs as well.
What if you are active and still need to have the physical therapist?
That's fine. You can go ahead and just ask your physician for that referral and they'll get you set up. And you can meet with them once, twice. You and the physical therapist work together in creating that plan. Yes.
Deal with pain.
Maybe we should have a whole talk about that, right? Because that's a big topic. Maybe Aaron will write that down. Maybe we talk about pain in the future. So the question was, how do we deal with pain? Okay, so pain is a complex topic, right? So let's think about how we normally deal with pain. What do? We reach in that cabinet, right? We usually pull out a pill. Yeah, right. Say that 3 times fast. Now, that can help and that can be appropriate. But if that pain keeps persisting, first, we need to try to figure out why we're having the pain. Sometimes that's easy, sometimes it's not. And the longer we have pain, the lower of a threshold we have. So what I mean by that, and maybe this might not be a good example, but let's say, what's your name? Judy. Let's say Judy punched me in the arm. Sure. Okay, so that didn't hurt, okay? Good job, Judy. So that didn't hurt. But if I'm someone that has dealt with pain a long time, my threshold can be a lot lower. And the pain, we almost become very sensitive to pain. And then Judy's punch may have hurt, okay? But there are treatment programs for that. Now, unfortunately, the main way we get treated right now is medications, surgery, injections, that kind of thing. That's unfortunately our main front. And my theory is the reason why is people want an easier fix. You know, they want that pill or that injection. There can be more permanent fixes if you are up to the challenge and work on it, and we have to get moving, and we may also have to think about it in a little different way as well. Yeah, there's a big mental aspect with pain, particularly the longer we have that. The longer we have pain, the more of a mental aspect that is. So again, talk with your healthcare provider and remember what matters most to you. No, I don't want to take a pill. I don't want to have an injection. You want to avoid surgery at all costs. What other options are there? And hopefully physical therapy, occupational therapy, those are all ways that we can help reduce pain. And also maybe engage in there are some programs like just mindfulness programs, calming programs that you can use. Some of them are online that you can use that have been shown to help reduce our pain as well.
Deal with pain, take more pain than others?
Yes, and that's because of pain. When we have pain, it's a stimulus that comes in and it gets processed in our brain. So, for instance, I had a kidney stone a couple years ago. Okay, so I had I had an X-ray of my low back and my hips. Okay, so the X-ray showed degenerative discs, right? But I know that doesn't necessarily relate to pain. So I was like, that's just normal aging. We all have wrinkles on the inside. Just because an X-ray told me I have a degenerative disc doesn't mean, yeah, it doesn't worry me because I know that's normal. It doesn't necessarily correlate with your pain. So you have to keep that in mind as well. And that's where kind of the mind and our beliefs. So when we get a stimulus, our brain processes that, and we all have different experiences. We all have different education. We all have it gets all mixed up, and we have to make a decision about the pain. And if your brain decides that you are threatened, you'll feel it. But maybe your brain decides you're not threatened and you won't feel it. And I know women are tougher than men. I know that. So yeah. So
All right.
I think there's something over online.
Yeah, we're going to wrap up. Thank you everyone for attending the Age Well series today. We appreciate you all, and we hope to see you at upcoming sessions. Take care, everyone.
Thanks, John. Thanks, everyone.